जय हिंद एंड वेलकम बैक टू माय चैनल मेट टॉक्स विद रोशनी।
सो गाइज़, मैं आज आपके लिए लेके आई हूँ 10 ऐसे MCQs जो कि बहुत फ्रिक्वेंटली पूछे जाते हैं हर गवर्नमेंट नर्सिंग के एग्ज़ाम्स में। एंड बिलीव में ये बहुत हेल्पफुल रहेगी। टेक अ कॉपी एंड पेन एंड गेट स्टार्टेड विद ऑल दिस क्वेश्चन एंड आंसर्स। देर ना करते हुए शुरू करते हैं हमारे पहले क्वेश्चन से। द फंक्शन ऑफ choroid plexus is, options are number A to produce lymph, number B to produce blood, number C to produce CSF, and number D to produce endolymph. So the answer to our question is the function of choroid plexus is option number C to produce CSF. Let's jump on to the second question. RH factor can produce, options are number A sickle cell anemia, number B Turner syndrome, number C AIDS, and number D erythroblastosis fetalis. So the answer to your question, RH factor can produce, is option number D erythroblastosis fetalis. For those who don't remember what it is, let's speak on to the definition. Erythroblastosis fetalis is hemolytic anemia in the fetus or neonate as erythroblastosis neonatorum. It is caused by transplacental transmission of maternal antibodies to fetal red blood cells. The disorder usually results from incompatibility between the maternal and fetal blood groups, often RHOD antigens. Our third question, a patient with cholelithiasis is admitted to the hospital for a surgical procedure called cholecystectomy. According to the nurse, which of the following clinical findings is possible to be seen post-surgery? Options are number A, impairment of fat digestion, number B, impairment of protein digestion, number C, jaundice, and number D, increased acidity in intestine. आपने सुना होगा डॉक्टर हमेशा ऐसे पेशेंट को कहते हैं कि ऑयली फूड ना खाएं। सो इससे आप समझ सकते हैं कि आंसर होगा ऑप्शन नंबर ए, इम्पेयरमेंट ऑफ फैट डाइजेशन। नंबर 4, fallopian tube is lined by, options are A, stratified epithelium, B, germinal epithelium, C, ciliated epithelium, and D, cuboidal epithelium. So our fallopian tube is lined by option number C, ciliated epithelium. Moving on to question number 5. The denominator for the breech presentation is, options are number A, coccyx, number B, femur, number C, sacrum, and number D, lumbar. Answer to our question will be the denominator for the breech presentation is option number C, sacrum. Moving on to the sixth question. Which of the following food constituents are more required by pregnant women? Options are number A, calcium, B, vitamin C, iron, and number D, potassium. वैसे तो सभी नेसेसरी हैं, लेकिन हमें सबसे इम्पोर्टेंट वाले को चूज़ करके ऑप्ट करना है। सो हमारा आंसर होगा ऑप्शन नंबर C, iron. Moving on to our seventh question, the nurse documents that a patient has Kussmaul respiration when the respiration are, options are number A, rapid and deep, number B, slow and regular, number C, slow and shallow, and number D, rapid and irregular. Before jumping on to the answer, let's see to the definition of Kussmaul respiration. Well, Kussmaul breathing is a type of hyperventilation that is the lungs' emergency response to acidosis, okay? And Kussmaul breathing causes a labored, deeper breathing rate. The answer is hidden right here in the sentence and it is option number A, rapid and deep. आगे बढ़ते हैं हमारे 8वें क्वेश्चन की ओर। The following physiological function of the body that helps prevent infection is, options are number A, the rapid expulsion of stool from the intestine, number B, the flushing action of urine flow, number C, a high pH gastric secretions, and number D, an elevated temperature. क्वेश्चन को दोबारा पढ़ें। The following physiological function of the body that helps prevent infection is, आंसर होगा ऑप्शन नंबर D, an elevated temperature. Moving on to our 9th question, which day is celebrated as Labor Day? Okay, let's see for the options. Options are number A, 1st May, B, 30th June, C, 1st June, and D, none of these. The answer to our question is option number A, 1st May. Finally, question number 10. From the following, which statement defines the term sepsis? Options are number A, infection in the blood, number B, destruction of pathogenic organisms, number C, presence of pathogenic organisms, and number D, absence of infection. सारे आंसर सिमिलर लग रहे हैं, लेकिन हमें मेडिकली जो डेफिनेशन सेप्सिस के लिए सूट करता है उसे ही टिक करना है. सो अगर आप नोट करें तो हमारा ऑप्शन नंबर सी जो है, प्रेजेंस ऑफ पैथोजेनिक ऑर्गेनिजम्स, एकदम सही बैठता है. Therefore, our answer to the question is option number C, presence of pathogenic organisms.
गाइस, मैंने आपका टाइम वेस्ट नहीं किया होगा एंड ये वीडियो आपके लिए हेल्पफुल रही होगी. मिलते हैं अगले वीडियो में कुछ ऐसे ही कंटेंट के साथ में. टिल देन टेक केयर.